What if I told you that there was an 80% chance that the brakes in your car were going to go out at some point in your lifetime? Would you go get those brakes changed, or would you take that risk? Would you be happy that you were given the knowledge to take action before it was too late? What I want you to do is really think about this question, but put it in your pocket for now because we are going to be revisiting it later. Cancer is something that has affected us all in one way or another, whether it was us who was going through it or a loved one. It is one of the most horrific things to witness or experience. But luckily, advancements in medical technology have allowed us the opportunity to be tested in order to determine if we're at a higher risk of developing cancer. How do I know this? Well, in 2013, I received genetic testing that determined I was BRCA1 or BRCA1 positive. I've seen both ends of this gene mutation. On one hand, you have my Aunt Amy, who found out she was BRCA positive only after being diagnosed with ovarian cancer. This is the same ovarian cancer that eventually took her life. On the other hand, you have my mother, who found out she was BRCA positive before any cancer was detected, and she was given the ability to take proactive measures to prevent the same fate. If you have a family history of ovarian or breast cancer, or both, I urge you to receive genetic testing in order to determine if you're at a higher risk of developing cancer. First, today we're going to be talking about genetic testing. Secondly, we're going to address BRCA1 and BRCA2. And third, we're going to talk about why you should receive this genetic testing. According to Karen Heller, genetic testing is used to determine paternity, detect cystic fibrosis genes, Alzheimer's, BRCA1 and BRCA2, along with much more. It's a very easy and painless process. It's a simple blood draw in which they send your blood to the lab in order to determine if there's any deletions or mutations in the genes. With that simple process, you are given a wealth of knowledge. Now that we know a little bit about what testing is, we're going to talk about one specific thing that it is used to test for. Now, you've heard me say BRCA1 and BRCA2 on multiple occasions, but what is it? You may recall, not too long ago in the media, Angelina Jolie came out about a story involving her family and their increased odds of developing cancer. She also shared with the world that she got preventative surgery to decrease those odds. Well, that's the same thing we're talking about today. BRCA1 and BRCA2 is the deletion or mutation of that specific gene that increases the odds of developing breast cancer, ovarian cancer, and several other cancers as well. Now, this increase is not minimal. As you can see in this graph, a normal individual has about a 1.3% chance in their lifetime of developing ovarian cancer and a 12% chance of developing breast cancer in their lifetime. Here in the red is the BRCA gene mutation, and you can see it's significantly higher. An individual with a BRCA gene mutation has about a 40 to 60% chance of developing ovarian cancer in their lifetime and a 60 to 80% chance of developing breast cancer in their lifetime. These numbers are absolutely staggering. Now that we know a little bit about the testing and a little bit about BRCA1 and BRCA2, let's talk about why you should get tested for this. What's the point? What's the benefit? How is it going to benefit you from knowing that you're at a higher risk? Well, in this case, knowledge is power. You're given the power to take control and choose your fate when you get genetic testing. Because the odds of developing breast cancer and ovarian cancer are so much higher with this gene mutation, you have to be proactive. There are a couple options for being proactive. There's surveillance, which means that you have increased exams in order to detect the cancer early on. Now, this is a less invasive way of handling the positive results, but it's not 100% guaranteed. In fact, many people feel like it takes away their quality of life because every 6 months you're going into your doctor appointment just hoping that they haven't found any cancer. A more aggressive way of treating it is preventative surgery. Now, this can be extremely difficult to make this decision, but according to the American Society of Clinical Oncology, it can decrease your odds of developing breast or ovarian cancer by 70 to 90%. Now, there is no right or wrong answer in determining how to go about your future actions after finding out that you're positive for the gene mutation, but I ask you to consider this one thing. There is no good way of detecting ovarian cancer. Most ovarian cancers are detected in stage 3 and 4, and at that point it is too late for you to make any choices or take any action. Now, we've talked about genetic testing, we've talked about BRCA1 and BRCA2, and we've talked about why you should get this testing done. If you have a family history of breast and or ovarian cancer, I urge you to receive genetic testing in order to determine if you're at a higher risk. My grandmother died at the age of 33, and I have to believe that this is in part due to the fact that she could not receive genetic testing and she wasn't able to be proactive. It is certainly scary to obtain this knowledge, but it is scarier to live a life of denial that leads you to stage 4 cancer in which you have no other choices and no other options. Now I ask you to revisit that question I asked you before, and I want you to apply it to BRCA1 and BRCA2. If you were told you had an 80% chance of developing cancer in your lifetime, would you do something about that, or would you take the chance? Would you be happy that you were given that knowledge in order to take action before it was too late? Thank you for watching, and I hope that this urges you to go and get that testing done. Thank you.